Every morning across the country, practice owners and physicians walk into their clinics praying they won't see an empty chair at the front desk. Finding a highly qualified clinician is difficult, but keeping that front desk adequately staffed has quietly become the highest hurdle in modern healthcare operations. You cannot drop a general administrative hire into these positions. A medical support professional operates at a specific intersection of clinical workflow understanding, HIPAA compliance, insurance verification, and patient communication. This chart shows the results of a recent Medical Group Management Association poll. 53. Without proper support, physicians frequently absorb the overflow, spending nearly 16 hours every week on administrative tasks, scheduling, and authorizations instead of treating patients. This friction forces highly trained medical providers to act as part-time data entry clerks. It limits the number of patients a clinic can see and accelerates physician burnout. To understand why this staffing cycle drains so much capital, we have to look at the math practices used to hire. Most clinic owners budget $40,000 for a new administrative hire, focusing strictly on the base salary. But when you map out the actual expenses, this animated comparison shows a very different reality. Compare that small $40,000 salary block to the true, fully loaded annual cost, which runs between $60,000 and $72,000 for a single in-house employee. That $20,000 to $30,000 gap comes from invisible overhead. Employer payroll taxes add roughly $4,000. Health insurance contributions pull another $7,000 to $9,000. Add in paid time off and the initial $2,000 to $4,000 drag of onboarding and electronic health record training. All of that investment is fragile. Healthcare front office and business support staff experience a 30% to 40% annual turnover rate. When an employee leaves, that initial cost structure is wiped out and replaced by a $30,000 to $50,000 replacement penalty. Every single time a practice enters this cycle, they lose weeks to recruiting, pay posting fees, suffer a drop in productivity while the role sits open, and then spend months retraining the replacement on their specific billing workflows. Medical groups are draining their operating margins because relying entirely on the local in-house hiring loop for these specific roles is a mathematically broken system. To solve this math, more than 800 healthcare providers have abandoned the local hiring loop. They use specialized, outsourced department support through partners like Staffingly. Staffingly bypasses the general staffing agency model by exclusively deploying credentialed healthcare professionals into these roles, including medical doctors, doctors of pharmacy, and licensed registered nurses. Having that level of clinical expertise on the administrative side pays immediate dividends. A doctor of pharmacy handling your prior authorizations already understands medical terminology and drug interactions. They navigate payer requirements accurately from day one, minimizing denied claims. Alongside the clinical precision comes an aggressive economic correction. Staffingly provides this specialized department support starting at $8 per hour for a full-time equivalent. This chart highlights what that does to the balance sheet. Over a year, at baseline engagement totals $16,600 per full-time equivalent. Compared to the $72,000 of a fully loaded in-house hire, practices achieve a cost reduction of 70%. By sourcing specialized clinical talent globally rather than relying on local generalists, clinics erase the hidden overhead of taxes, benefits, and turnover, while upgrading the actual competence of their team. It is natural to question how a remote team can securely integrate into the tightly controlled workflows of an independent medical practice. The system relies on strict structural fail-safes. Professionals through Staffingly are assigned exclusively to one practice. There is no rotating staff and no shared accounts, which prevents the errors associated with general call centers. Before an outsourced team member ever touches a live patient file, they go through comprehensive onboarding. They're trained specifically on your clinic's electronic health record system and align with your distinct scheduling and billing workflows. Data security is handled at the enterprise level. Operations run through encrypted VPN connections, backed by SOC 2 Type 2 certification, HITRA trust alignment, and full HIPAA compliance. This secure infrastructure scales frictionlessly with your clinic. If you bring on a new provider or open a new service line, your administrative support expands without triggering a frantic new hiring search. Practice administrators prioritize autonomous department leadership over simple task completion. Managing a constantly revolving door of in-house staff drains energy away from patient care. An invested, specialized partner monitors your systems, catches billing lags early, and proactively solves workflow gaps before they escalate. We can see this level of ownership in public feedback. One practice administrator highlighted their Staffingly team leaders specifically because they helped in departments where truly needed. This level of accountability shifts the dynamic from a simple vendor arrangement to a functional partnership. You do not have to accept constant turnover and hidden overhead as the cost of doing business. You can step out of the staffing cycle, stop the financial bleed, and upgrade the leadership in your administrative departments. Staffingly offers a risk-free 30-day trial to prove their model works for your clinic. Visit staffingly.com/demo or call 800-489-5877 to speak with a department support specialist today.